Hello, my name is Jessica Wilson, and I did my presentation on medical errors in the United States. Medical errors are the third leading cause of death in the United States, behind heart disease, which is number 1, and cancer, which is number 2. This accounts for about 3% of hospital-related deaths. The data I collected is from 2010 because this was the most recent year that had all of the data that I needed available. In 2010, as you can see in the chart here, there were 16.2 million hospital admissions. 4% of the total admissions, about 715,000 people, died in the hospital that year. They died 4%. 4% of the total admissions died in the hospital that year. 3 out of 4% of the deaths, which would be 440,000 people out of 715,000 people, died from preventable medical errors. About 15,000 Medicare patients die each month in part because of care they received in the hospital. This accounts for about 180,000 people per year. 44% of these deaths are considered to be from preventable errors. On a separate scale, 45% of pediatric harms are considered preventable. In 2010, preventable medical mistakes cost the United States $17.1 billion, which is a 12% decrease from 2008 to $19.5 billion. Some of the factors that we have now utilized to decrease medical mistakes are computerized provider order entry, or CPOE systems, which allows providers to enter their own orders instead of handwriting them, which can be hard to decipher, or asking a nurse to do it, which can also lead to some errors. High alert medications are double checks. 2 RNs are required to sign behind certain high alert medications like insulins and strong blood thinners like heparin. Barcode scanning systems are also a nice tool that they've started to utilize, where you actually have to scan the patient's armband and scan the medication before administering the medicine to the patient, in addition to asking them their name and their date of birth to prevent errors. Some results from using these in the past few years have been a 52% decrease in adverse drug events, 25% decrease in complications, 14% decrease in events that led to unfavorable outcomes to the patients, and near misses are down by 3%. Thank you.